The topic that my group members and I will be discussing today is on Fragile X syndrome. As we begin this presentation, we will first start off by explaining what Fragile X syndrome is and some of the background information on the syndrome. We will then jump into the historical background to explain some of the characteristics and symptoms that an individual can experience with Fragile X syndrome. We will then explain some of the statistics surrounding this syndrome and address the epidemiology and etiology. This will then be followed by some treatment approaches and the presence of Fragile X syndrome within the media and how it is displayed. Finally, we will end off with an overall summary and conclusion. So, what is Fragile X syndrome? Fragile X syndrome, also known as FXS, is a genetic disorder. A genetic disorder means that there are changes to that individual's genes. FXS is the leading form of intellectual disability and autism spectrum disorder, and individuals can often display severe behavioral alterations, which include hyperactivity, impulsivity, anxiety, as well as poor language development and seizures. The Fragile X mental retardation 1, also known as FMR1 gene, is changed, which causes someone to have FXS. The FMR1 gene usually makes a protein called Fragile X mental retardation protein, also known as FMRP. Without FMRP, there will be abnormal brain development, and individuals who have FXS are unable to make the FMRP. Individuals who have alternative Fragile X associated disorders have changes in their FMR1 gene but usually make some of the protein. Both male and females can be affected by FXS, although the symptoms in females are much milder than men. Now we will be moving on to the historical background regarding Fragile X syndrome. We will first start off by listing some of the symptoms and characteristics. Fragile X has been a known genetic disorder for several generations. Because of this, we have documented the evolution of the disorder's clinical profile. As you can see, in the 80s and 90s, there were a myriad of associated symptoms and characteristics which are not all recognized today. The most common being intellectual disability, behavioral abnormalities, connective tissue disorders, dental crowding, and more. There was also some confusion during diagnosis because of the symptom profiles that mimic other developmental disabilities, which also include overgrowth manifestations, including Sotos, Prader-Willi syndrome, and FG syndrome phenotypes. Another issue includes Robin syndrome, which includes a smaller than normal lower jaw and a tongue that is placed further back than normal, and an opening in the roof of the mouth, also known as cleft palate. DeGeorge anomaly is also another issue that was included, and this consists of congenital heart problems, specific facial features, and other symptoms. So fast forwarding a few decades to the late 2000s, we start to see a more simplified clinical profile. Unfortunately, despite a more modern clinical profile existing, the literature still used some terms that were acceptable at that time. FXS symptoms are now described as existing on a continuum from learning problems and a normal IQ to what they describe as severe mental retardation and autistic behaviors. It is important to note that because this is an X-linked disorder, the representation of symptoms varies between sexes. The majority of individuals have standard intelligence levels, but males are prone to attention problems, executive dysfunction, which means that they struggle with planning, problem solving, organization, and time management, as well as social deficits and obsessive compulsive behavior. Females are affected less so than their male counterparts, particularly in terms of cognitive functioning, but they tend to be at higher risk for emotional problems compared to the general population. Unfortunately, there is also a discrepancy between American and European scientific journals. While it is beyond the scope of this assignment to investigate this difference in the symptomatic presentations of Fragile X syndrome, one could assume that the differing geographical genotypes, reporting biases, and cultures may contribute to this discrepancy in the literature. In addition, as our collective understanding improves, perhaps some of these symptoms were reattributed to other developmental disorders and diseases over the years. So one unique aspect of Fragile X syndrome is that each child may present differently. This phenotypic screening checklist proposed by Mays et al. Says that at least 17 of the 26 items should be checked off to suspect Fragile X syndrome. So as you can see, there is a heavy emphasis on behavioral symptoms rather than physical characteristics. This is also reflected in the previous slide as we move away from physical characteristics and towards behavioral issues. This shows that Fragile X syndrome does not always follow the same symptomatic patterns, nor is there multiple discrete symptoms groupings like other disabilities. For example, there are 2 main types of diabetes, or there are 3 main types of bipolar affective disorder. Now we will be moving on to the epidemiology part of this presentation regarding Fragile X syndrome. So although Fragile X syndrome is the most common cause of inherited intellectual disability, the exact number as to how many individuals are affected by the IDD is unknown. It has been estimated that approximately 1.4 per 10,000 men and 0.9 per 10,000 women have FXS. A study that was conducted by the CDC discovered that FXS had a strong correlation with ASD. The study showed that out of 577 people with FXS, 40% of the individuals with FXS had a concurring condition of ASD. The study also indicated that due to this correlation, 40% of individuals were given treatment with medicine for aggressive and disruptive behaviors and were less likely to receive behavioral therapy. When comparing between male and female populations, it has been shown that although males are twice as likely to inherit FXS, females are 4 times more likely to be carriers. This is due to the fact that females carry 2 X chromosomes, therefore one can be affected and the other will function normally, thus resulting in FXP, whereas males only have 1 X chromosome. Cognitive functioning is very hampered for males. Studies have shown that men are less likely to be able to read books, speak using complex sentences, or speak at a normal speed. This is displayed in the chart that we have inserted, in which males have a lower percentage when it comes to females in regards to cognitive functioning. When comparing the ability for men and women to be able to live normal lives, it has been shown that about 40% of women with FXS achieved a high or very high level of independence in adult life compared to about 10% of men. About 4 in 10 women with FXS lived independently, often with a spouse or romantic partner, compared to 1 in 10 men who lived independently and rarely with a spouse or romantic partner. About 8 in 20 women with FXS required no assistance with activities of daily living compared to 1 in 20 men. Almost half of women with FXS had a full-time job compared to 2 in 10 men. Now we will be moving on to the etiology of Fragile X syndrome. The root cause for Fragile X syndrome is traced back to the genetics of an individual. Individuals with FXS have certain mutations to their gene sequencing which causes them to have developmental problems and intellectual disabilities. A gene known as FMR1, also known as Fragile X mental retardation 1, is crucial for natural brain development. FMR1 produces a substance known as FMRP, also known as Fragile X mental retardation protein, which is essential for cell-to-cell communication in the neural system. In the FMR1 gene is a DNA segment known as CGG trinucleotide repeat. FMRP is seen in many of the areas of the body, such as the brain, ovaries, and testes. FMRP is necessary in the brain as it helps regulate synaptic plasticity, which is important for learning and memory. It is also believed that FMRP acts as a shuttle that transports mRNA from the nucleus to other parts of the cell, therefore making them an important substance in the building of proteins and functioning of nerves. When mutations of this gene sequence occurs, it results in the shut-off of the production of FMRP. This then leads to the development of FXS. Inheritance of FXS is mainly dependent on the probability of the parents having the dominant gene. In normal individuals, the CGG sequence is repeated 5 to 40 times. However, when a mutation occurs in this gene, the CGG DNA sequence is repeated more than 200 times. Some individuals can technically have FXS and be seen as normal without showing any symptoms and are therefore labeled as carriers. When it is passed down, a mother can pass down the gene sequencing, providing a 50-50 probability for their offspring to inherit FXS to either their son or daughter. Fathers, on the other hand, can only pass down FXS to their daughters. We will now discuss some of the medical and non-medical treatments for FXS. So some of the medical treatments include medications that handle behavior issues which are involved. Most of the common medications include serotonin uptake inhibitors, which are also known as antidepressants, and they are used to increase the levels of serotonin in the brain. The main use of the antidepressant is to combat anxiety. The use of serotonin reuptake inhibitors are most common in females than in males, and antipsychotics, which are used to treat irritability, and they would also be used to address aggressive behaviors. Additionally, both medications would improve attention and hyperactivity. Alpha agonists are also used in order to address sleep problems, which are common for people who have Fragile X syndrome. Alpha agonists also help with maintaining and helping the patient fall asleep. Some of the non-medical treatments include speech and language therapy, which is usually recommended for children early on in the diagnosis. Behavioral therapy has also been proven to be successful in reducing aggression in patients, and this has been usually seen around 71% of patients. Occupational therapy can also be used in order to improve fine motor skills. Physical therapy would also be used for musculoskeletal impairments. An example of what physical therapy could do for people with Fragile X syndrome are improving walking skills for children who have less refined motor and balance skills. Cannabidiol is one of the new or potential treatments that's out there to treat FXS. This medication is used mainly to treat inflammation and has the potential to reduce anxiety, and it also can act as an antipsychotic drug. In the case of FXS, this drug can be used to treat the seizures and anxiety disorders that are often associated with FXS. 80% of men who suffer from FXS suffer from anxiety disorders, and 20% of people who have FXS suffer. Considering that CBD can be used to address both issues, it would eliminate the usage of multiple drugs that address anxiety disorders and seizures. According to one study that was done, CBD has the potential to be safe to use for humans even if one were to take high daily doses of the drug. CBD can be purchased in many countries, specifically in marijuana shops. Lovastatin is also one of the third new potential treatments out there to treat FXS. This drug is currently being used to treat hypercholesterolemia. This drug was used in one study to see if lovastatin can improve social skills in people who have FXS. It was determined that in the study that the participants who did take the drug was found to have better communication skills, living skills, and can socialize better. Currently, the drug is available for use for people with hypercholesterolemia. However, the full results of the study is not available as of now. Acamprosate is also a new and potential treatment to treat FXS. Acamprosate is currently being used to aid alcoholics with their addiction. One study was conducted with 12 child participants, ages ranging from 6 to 12 years old, who have FXS. This study was conducted over a 10-week period, and each participant was given a Campersate each week. Out of the 12 participants, 9 participants showed a response to the treatment where the treatment affected their social behavior skills as well as their hyperactivity. Now we will be talking about Fragile X syndrome and the presence of this disorder in the media. So What Makes Me Rare is a campaign which spreads compassion, awareness, and action. What Makes Me Rare is a rare disease day which occurs on February 29th, and it's the day where individuals demand more awareness, more action, and more compassion towards those who endure a rare disease. Another quote of theirs is, "Let's flood the internet with our voices to make our strength known." It increases equity and is aimed for people who endure rare diseases in hopes to encourage positive sharing of stories and experiences on social media. Those who posted videos and stories were featured on BioNews' social media platforms to help raise awareness and educate about rare diseases, including Fragile X syndrome. This is just an example of what one of the advertisements of one of the conferences may look like in regards to Fragile X syndrome. As we finish off the presentation, we noted that Fragile X syndrome causes changes to an individual's genes, and it is the leading form of intellectual disability and autism spectrum disorder. As we saw in the 80s and 90s, there were many symptoms and characteristics which are not all recognized today. But as we moved towards the late 2000s, there was the development of a more clinical profile of signs and symptoms such as cognitive issues that included working and short-term memory, language delays, and etc. Since this is an X-linked disorder, it was important to note that the signs and symptoms of Fragile X disorder can vary between sexes. It has been estimated that approximately 1.4 per 10,000 men and 0.9 per 10,000 women have FXS. We have also noted that some of the important treatments can include medical and non-medical options, such as medications which handle behavioral issues, and speech-language therapy, which is recommended for children with early diagnosis. We also covered how FXS is displayed in the media today, as we shared the What Makes Me Rare campaign, which increases awareness on FXS and encourages hope and positive thinking to those who share a rare disease by expressing them through social media. Although there is no cure for FXS, it is important that individuals obtain the treatment that they need in order to learn important skills and improve the health and well-being of individuals with these conditions. We hope you all learned about FXS and enjoyed our presentation. Thank you for listening.